This is Steve Zeltzer with Pacifica. The crisis of the coronavirus is ground zero in California, where a ship, the Diamond Princess, with over 3,000 people, is sitting outside the coast waiting to go in to a port. Many of the, not only passengers, but the workers on the ship themselves have been contaminated. The issue of health and safety for workers in this crisis, both in California and nationally, is of course paramount. For doctors, nurses, hospital workers, transit workers, and education workers, the need to be protected, educated, to help themselves and help the public is critical. And joining me today on Pacifica is Dr. Larry Rose, who was the former medical director of Cal-OSHA and was involved in the SARS crisis in the past in California. Welcome to the show.
Yeah. Hi, Steve.
So, Dr. Rose, why don't you talk about what happened with the SARS crisis and how that was handled by Cal-OSHA in California?
Well, first of all, regarding Cal-OSHA, it's been a seriously weakened agency by inadequate staffing. The ratio of compliance health and safety officers in Cal-OSHA is one officer per 90,000 workers, which is ridiculously weak. And then the medical unit, which would take the lead in investigations of corona, the novel coronavirus, this outbreak. There's only one doctor for the entire state in Cal-OSHA and one nurse. So there needs to be a quick strengthening of Cal-OSHA, because almost every business that deals with the public is being impacted. And the problem is that there aren't enough compliance officers in California. California has a state program, and it's a very weak program. It's much weaker than the state programs in Oregon and Washington, and this should be immediately addressed with this outbreak primarily in Washington, state of Washington, but it's occurring throughout the country.
Again, we're talking with Dr. Larry Rose, former medical director of Cal-OSHA. Now, under the previous Brown administration and now the Newsom administration, there are more fish and game inspectors than inspectors for the health and safety of the workers, Cal-OSHA. Why is it that there aren't enough staff to protect the workers of California?
What was appointed as the leader of the Department of Industrial Relations, Christine Baker, has failed to keep the adequate number of compliance officers and health and safety in Cal-OSHA. She just failed. She did not hire enough compliance officers, and that's been severely weakened the agency.
And what was your experience during SARS, the SARS crisis in California?
Most of the SARS outbreak was a deep concern for medical facilities, for the clinics, emergency rooms, hospitals, etc. And this is much worse because the outbreaks that are occurring both in medical-related workers, healthcare workers, and in other workers that are being exposed. And the CDC has come up with a number of guidelines, but these have to be implemented by local health workers working for public health agencies. And so recently, the CDC guidelines have been revised in view of the number of cases that are coming up nationally. And the last update was just 2 days ago, and it looks like they're going to continue to update and get more strict about the measures that have to be taken to contain the number of active cases that are occurring.
Well, California AFLCIO has a membership of 1.2 million. Why and where is the California AFLCIO demanding that there be proper staffing and an emergency additional staffing at Cal-OSHA?
That's sadly sadly lacking. We're not getting the kind of 20 years ago, a little longer perhaps. The unions were very involved in health and safety issues in the state of California. The local shop stewards were often very well informed as to what the regulations were, and often when we'd go out and do investigations, the shop steward with the responsibility for health and safety in the given workplace would accompany us. Now you don't see much of that. The unions have gotten so weak, and the State Federation of Labor has been so silent that that's really the effectiveness of Cal-OSHA compliance.
Now, another issue that has faced workers in California is at the Division of Industrial Relations, where Christine Baker, the former director of the Division of Industrial Relations, supported deregulation of workers' compensation, put her daughter on the payroll on a no-show job at over $100,000 a year. What happened at the Department of Industrial Relations, and why was Christine Baker allowed to do this without really any accountability or prosecution by the Attorney General, Xavier Becerra?
Well, yeah, essentially the whole rationale, or the whole policy put forth by Christine Baker was that Cal-OSHA should not do a I gotcha kind of compliance. In other words, should not be issuing so many citations when employers are violating the regulations. Instead, she said we should partner with business, and we should work with them, that kind of policy was heavily instituted in the agency.
And Garrett Brown, who is an expert, also has been following the situation at Cal-OSHA. There have been reports that the employees at Cal-OSHA, the inspectors and other workers, have been bullied, have been terrorized, so that they themselves are afraid to speak out about issues. Is that true?
Yes, absolutely true. The way she behaved was that if you didn't act as though you were a partner of industry, and if you were a strict enforcer of the laws and regulations that really at the basis of Cal-OSHA effectiveness, if you behaved like a strict regulator, often you were demoted or threatened and so forth.
And Ellen Wadess was removed. What was that about? She was the former officer of Cal-OSHA.
Yeah, she was the chief of Cal-OSHA and under the Department of Industrial Relations. So the big crisis came in 2012 in Richmond when the Chevron plant was processing the very dirty crude oil from North Dakota and from Alberta, Canada, and was causing problems with the pipes in the refineries. One of the pipes that was processing these dirty crude oils started leaking, and it was under pressure, and it was spraying out the crude oil fumes. And workers responded and said, we have to shut this unit down. And the management of Chevron in Richmond said, no, don't shut it down. And they said, well, it's a real problem. And so the workers were stuck there, about 20 workers, right where the pressurized gases were escaping, and somehow they caught fire. It was probably from the fire engine that was close by. So the workers ran as for their lives because they realized that it was an explosive release. And it did indeed catch fire. And the mushrooming cloud that went up 5,000 feet and exposed all of the residents in Richmond and adjacent residents as well. 5,000 of them had to go to the emergency rooms with respiratory, reactions, acute respiratory reactions to these very toxic fumes. Ellen Wadess was the chief of Cal-OSHA then. So she headed up the investigation, and she found multiple serious, willful violations up by management, and issued a number of citations. They weren't very heavy in terms of what it was going to cost monetarily for Chevron, but it just showed how negligent they were, and actually criminal in what their response was to that emergency. And so shortly thereafter, Christine Baker fired Ellen Wides, and that was directly related to her honest investigation of what happened by the Chevron upper management in 2012.
And we're talking to Dr. Larry Rose, former medical director of Cal-OSHA. And there are also, in the Bay Area, the issue of Treasure Island and Hunters Point, which were nuclear facilities, training facilities, and radioactive laboratories at Treasure Island and Hunters Point are now being developed with condos. And workers have complained, have been fired for saying that the testing by Tetra Tech and Test America was falsified on those sites. Now, the San Francisco Unified School District and TIDA, the Treasure Island Development Authority, want to put a charter school on the old shuttered Treasure Island Elementary School, even though children had gotten sick at that school. There have been calls to OSHA about that, Cal-OSHA, and apparently they have done no investigation at Hunters Point and Treasure Island, no investigation either of the health and safety problems and issues, and also the retaliation against workers, whistleblowers at those sites. Are you surprised by that?
No, not at all. Cal-OSHA essentially avoids doing any investigations that involve radioactive isotopes and exposure, environmental exposures to everybody in the vicinity. One of the worst areas was Hunters Point, Naval Shipyard, but Treasure Island, there have been preliminary, how do I put it? What they did was, what was done was a Geiger counter detectors of radioactivity in given areas. They found that Treasure Island all of it was heavily contaminated with radioactive isotopes like cesium-137, plutonium, and on and on. And so this was kind of covered up, and nothing was done. The Treasure Island...
TIDA, Treasure Island Development Authority.
Right. TIDA just went right ahead and with a plan to reopen a school as a charter school where had already been shown to be highly radioactive. And that's outrageous. And Cal-OSHA did not respond to complaints about this.
Well, the question of corruption, and we see that in the falsification of testing at Hunters Point, Treasure Island. We see that in the fear that healthcare workers have of being retaliated for reporting health and safety dangers. What does that mean as far as workers getting protection in this latest pandemic coronavirus situation? Because it seems like workers themselves are going to have to take it into their own hands and organize it. It's not going to come from Governor Newsom and government agencies, which are supposed to protect the public.
Yeah, well, all of these excellent guidelines that CDC has been putting out, but CDC does not do direct enforcement, the prevention of spread of COVID-19 virus outbreak. And so they rely on local health departments to organize and do what their guidelines, show. And they're very good guidelines. I mean, they just they categorize all the kinds of exposures, low, medium, and high, and they recommend various measures that public health departments should be taking. That is really not being done well. For example, the one test they have for an active infection by the COVID-19 coronavirus, it's a test kit. that has been manufactured and was being distributed by CDC, but not enough came to the various local public health departments, and that's been a big deficiency. We don't know the extent of the infection in the general population.
And what protection of workers getting training, if they have no training, workers in transit or in education, does that puts not only them in danger, but the students, the public also who would be in danger if they themselves are not protected, these workers, frontline workers?
Yeah, well, that's, again, would involve Cal-OSHA, because if the workers want more protection and the employer doesn't support that, Cal-OSHA should move in and demand, and Cal-OSHA does have a response plan. They do have one standard called it has to do with spread of disease by aerosol, and but it's mostly for healthcare workers. It doesn't include all the other workers in California that are dealing with the public and want protection. The employers, in many instances, have said, if you wear it's called a respirator, if you wear, nose-mouth protection while you're, giving service to the general public, we'll fire you because, you'll frighten away the potential customers. Well, that should involve Cal-OSHA in supporting these workers, these service workers. And as far as I know, they're not doing that. So, that is a serious deficiency for all workers in California.
Okay, well, I want to thank you very much. We've been talking to Dr. Larry Rose, former medical director of Cal-OSHA, and has some familiarity with SARS and the real problem that exists in Cal-OSHA in the protection of health and safety for California's 19 million workers. So thanks for joining us, Dr. Rose.
Oh, thanks for doing the interview.